Dr. Mike Wilson is home in Texas and back to being a dad
Oh, where you going?
of 7 kids. It is a far cry from the past month when he served as medical director of this New York City field hospital. He first spoke with VOA when he was midway through working 5 weeks straight.
This is day 22, 14-hour days with no day off yet.
When coronavirus numbers dropped in New York, Dr. Wilson returned home to his Texas hospital group and found himself unemployed.
There's a lack of patients to be seen, and so they don't need the staff. So nurses and physicians across the country have been laid off, furloughed.
In April, at the height of the pandemic, America's private healthcare industry laid off 1.4 million workers. Here's how that happened. When the pandemic hit, hospitals canceled lucrative elective surgeries to make room for COVID patients. Smaller hospitals, already struggling financially, were pushed to the brink. Additionally, regular emergency room admissions dropped dramatically as Americans feared entering the hospitals that were handling COVID-19 patients. Dr. Ruchita Gandhi treated a female stroke patient who delayed coming to the emergency room until it was too late.
We could see this clot and it was massive, and just all of us just felt this terrible sense of this is one of the cases that we really could have made a huge impact on. This woman had, if she had come within 24 hours, we probably could have pulled that clot.
With patients avoiding the ER and revenue down, hospitals cut staff. Some rural hospitals now operate with just 1 or 2 doctors in the emergency room.
That's not enough people.
Dr. KK Moody founded MDocs, a group of 23,000 emergency physicians. She says her members run the risk of being fired if they complain their facilities are understaffed.
If there is a multi-car pileup just outside the hospital, we need people there. We don't know when the surge is going to happen. We don't know when the emergencies will happen, so we have to be always ready.
Dr. Moody says America's hospitals have always faced financial storms, but now they are struggling in a hurricane.
This is not just an industry. This has become an industry, and it should not be. It should be about one human taking care of another human.
The $2 trillion coronavirus relief bill passed in March provided $100 billion for hospitals to recoup lost revenue.
Oh, thank you very much.
But that hasn't helped Dr. Wilson, who is polishing his resume. The first time he's done that in years. Carolyn Persutti, VOA News.